afternoon to all. I am Justine.
I am Michaela.
And I am Akili. Together we are
Jam Innovators.
And we propose the idea of creating a web application which will allow Vincentians to access the prices of hospital services such as x-rays and blood tests
and
online.
Schedule hospital appointments for these services online. It was apparent to us that the health sector lacks a system which would provide services to the general public in a timely manner, leading to loss of revenue and many frustrated customers. The current system is not attractive in any way to the upcoming generation of tech-savvy boys and girls or anyone at all who has access to the internet.
Have you ever been to the Milton Case Memorial Hospital to have a blood test, x-ray, or ultrasound done? If you haven't, firstly, a recommendation from a doctor must be given in order to have the procedure done. After this, one must join a queue and pay for the service at the steward's office. Then you will be given a receipt. After that, you must journey to the adequate unit to present your receipt to the administrative clerk. There you will be given a specific date and time to have the procedure done. Finally, you must wait until your name is called for you to get the service done.
Our project tagline is quite simple. We were looking for a self-explanatory way to educate the public about this new initiative, and we thought these 5 words were perfect, since the web application is aimed at eliminating certain procedures to save time, which helps to improve efficiency.
Book online, save some time.
We first came up with a hypothesis, which is services provided to each patient at the general hospital takes way too long. Then we looked at a possible solution. Solution creates a web app that is going to shorten the time taken for the general public to receive a service at the hospital. This web app will contain certain prices of the services offered at the hospital. It will also allow patients to schedule appointments online for each service provided.
Through the implementation of this idea, we hope to
1. Reduce the number of persons who are deterred by the inefficiency of the healthcare service.
2. Encourage more people to come to the hospital to have services done.
3. Incorporate more technology into the health service procedures.
4. More effectively use human and material resources of the general hospital.
And 5. Provide the Vincentian public with an easily accessible and high-quality healthcare service.
Requirements for the implementation of this idea. 1. All that is needed is a fast enough internet connection at your hospital.
2. The main server is required to maintain the work of the system and other IT facilities.
And 3. Administrative personnel and staff will require training.
Computers will also be needed to facilitate the use of the system. How will the idea work once implemented? This flowchart illustrates that.
Okay, first of all, the patient would log in, and then services provided at the hospital would be displayed on the prices page of the website. The patient would then proceed to select which service they require in the booking page on this website. They would send the reservation to the hospitals, and if the patient wants any changes done, they would make the necessary updates to the reservation.
How will the system cater for patients who require emergency services? They will have the option to click the emergency button. Along with having our objectives met, here are some changes that we expect to come about with the implementation of our idea.
Long waiting lines will become shorter. The congested hospital flow will now turn into a smoother ER flow, and frustrated patients would be more satisfied.
Who is our target market?
The general public of St. Vincent and the Grenadines.
All individuals who own or have access to a computer or other technological devices, as well as the internet. How will this idea impact the environment?
There will be less paper use for record keeping, and we would be one step closer to making the working environment of the general hospital paperless.
There will also be less wastage of human resource for redundant jobs, such as record-keeping personnel.
natural for individuals to have increased stress levels when their work cannot be done as fast or as easy as they would like. If this idea is implemented, it will definitely result in a healthier and more positive work environment, as it will reduce stress of workers' psychological well-being, knowing they can carry out a task easily and quickly. How will the government benefit financially?
First of all, if our aim of reducing the number of persons who are deterred by the time-consuming and inefficient present system is achieved, this will, without a doubt, increase the government's revenue.
Secondly, the amount of paper used for record keeping will reduce as appointments will be scheduled online, resulting in less money being spent for paper and ink.
Features of the idea that would make it viable, identified, and briefly explained.
The tagline will definitely be a contributing factor to making it easily identified, as there are no other competent entities in St. Vincent and Grenadines.
How will the government save resources?
The hospital would require less workers, or they could put them elsewhere. There will be no need for redundant jobs such as record-keeping personnel.
Paper and ink could also be allocated to other departments who need them more. What makes this idea innovative? Firstly, this idea is not in place in practice or theory in SPG, and it is obviously different from the current system in place. It speeds up time taken before one has a service done at the hospital, and it will without a doubt be convenient for both parties involved.
With all the amazing advantages associated with the implementation of this system, the idea also has some shortcomings.
1. The hospital runaround is not entirely avoided, as people are not able to pay online and still have to do so at the hospital.
A backup system would also need to be set up in case of a system failure. This is an additional cost.
And a limitation of this project is that there will be abuse of the system, especially because individuals have the option to choose the emergency option. Everyone might be tempted to do so.
What can this idea be materialized into? It may be improved so that individuals can also pay online for their service. To complement our idea, we have created a template for our website.
Okay. When the patient goes onto the website, first thing they will see is the welcome page. Okay, so first of all, they have to log in.
Thank you guys very much. The end of your evening.